You have seen your second and third year seniors. Describe a second year senior and third year senior as per the work and the schedule.
So like there is no much of a difference in when it comes to postings and works between a first year and a third year person. But the third year senior will be more oriented towards academics, and they will be doing works more related to their exams and thesis work. Whereas a first year and second year resident will be more into attending
Mm.
conferences, more into exploring new things. And so I think that is a major difference. The first and second year is for mainly experimenting, networking, and getting to know about the branch, like what are the different subdomains available under community medicine, what are the scopes
Mm.
of it. So I think the first 2 years will be more into researching these things and experimenting new things, whereas the third year will be more focused towards examination and with completing their thesis. That will be their more focus.
So, have you heard from your seniors? Have you talked to them about their thesis part? How difficult it is? How much time does it usually take?
So it like mainly depends upon what topic we take and the
Mm.
study setting we do in. Like if we are doing some studies within medical colleges or within the
Mm.
within some institute, then it's really easy. But if we are doing in community level, then it's quite difficult because it is dependent on a lot of factor. And COVID proved to be a very big challenge for those who are doing community based studies. So thesis will definitely take a lot of time and effort, but still, when we consider it as a learning experience, then it's going to be fun.